Hi, Dr. Sarah. My name is Elizabeth Singleton. I'm a P2 student, and in regards to our patient JC, after looking at her conversation and reviewing her chart and information, I noted that her overall goals are to lower her blood glucose level, as well as obtain better, tighter control of her glucose levels, and overall avoid another hospital stay like the one she had last month. So her medication regimen that she's currently on is Novolin 70/30. She's taking 20 units every morning, as well as 18 units every evening before dinner. So that's a total of 38 units, which gives her right at 0.59 units per kilogram. So listening to her conversation, I noticed some limitations that might indicate that Novolin's not the best regimen for her. She mentioned that her eating times are pretty unpredictable, her meal sizes also change frequently, and she likes to snack a lot. So Novolin probably wouldn't be the best for her because patients do have to really carefully monitor their peaks and make sure those match up with their meals to obtain good control. Also, she noted that last time she went to pick up her medication, it was quite costly, so she has been signed up for WellVista. So choosing a new regimen would require us to be restricted to WellVista's formulary, which could limit us as well. So reviewing her blood glucose readings recently, her average fasting was in the 230s, which was significantly higher than her goal of 80 to 130 as set by the ADA. And then her average 2-hour postprandial was at 217, which is again a good bit higher than her goal, which she should be at less than 180 according to the ADA. So again, listening to her speak and tell her story and what she's been going through, some concerns I have are for dehydration. Firstly, she mentioned several times that she's been thirsty recently, has felt very dehydrated, but has only been drinking about 1 to 2 glasses of water a day, and instead prefers Diet Coke because she likes the taste better. So that is definitely something that could put her at risk for being in the hospital later down the line. Because her blood glucose levels all trend above her goals, fasting and postprandial, she is at risk for some microvascular complications like neuropathy, retinopathy, and nephropathy. And she's already had one event of diabetic ketoacidosis, so that is something else we should look out for as well. Some limitations that might impact her ability to receive healthcare are economic. She did mention that her Novolin, last time she went to have it filled, was pretty costly. She is now signed up for WellVista, so that should help ease that burden, but she may have other economic burdens that could impact her ability to achieve proper health care. And she also appeared to have limited knowledge on overall diet, specifically a diabetic diet, and how to keep track and know what's best for her in terms of diet. And she also didn't seem too confident in her diabetes management. So as far as managing highs and lows, she might need some further counseling there. So I mentioned WellVista. It is a program that provides prescription medications to patients who are uninsured. So the program works directly with drug manufacturers to provide patients with their medications totally free of charge, but the medications must be on their formulary, so that is something we have to pay attention to. So based on her goals and the levels that she is currently trending, I would recommend a regimen that would allow us to tailor to her unpredictable eating schedule and allow her to achieve tighter control and administer her doses as she needs it. So I would recommend starting with 22 units of basal insulin, like insulin glargine, which is on the WellVista formulary, and that should be administered once daily. And she should also take 8 units of a bolus insulin, like insulin aspart, which is also on the formulary of WellVista, before each meal. So that would give about 0.7 units per kilogram, or a total daily dose of 46 units, which is higher than the 36 units she was at before, so that should help her get closer to her goals. If she needs additional help getting to her goals, she can titrate her basal insulin up by 1 unit per day until her fasting blood glucose is less than the goal of 80 to 130. Some other factors that may help her keep her blood glucose in tighter control is the insulin to carb ratio, which I calculated at to be 1 to 11. So the patient can count her carbs in each meal and adjust her bolus dose to cover those carbs to keep her blood sugar controlled following the meal. So she should add up the total amount of carbs that she's planning to eat in CalorieKing.com or a similar app like that can track carbs. And then she should divide that value by 11, and that should provide her bolus dose adjustment. A correction factor may also be beneficial for her to achieve tight control. So I could calculate her correction factor to be 37. So I would tell a patient she can check her insulin before meals, and if she finds that she's not in goal, she can factor that value in to determine how many units how many blood glucose points can she lower by injecting 1 unit of her bolus insulin. So that should help her achieve tighter control. Thank you.